Good afternoon, everyone, and welcome to today's update on the healthcare system. Bonjour tout le monde et bienvenue à cette mise à jour sur le système de santé. Speaking on behalf of the province today in the following order are the Honorable Dorothy Shephard, Minister of Health, Dr. France Desrosiers, President and CEO of Vitalité Health Network, and Dr. John Dornan, Interim President and CEO of Horizon Health Network. Les porte-paroles aujourd'hui sont dans l'ordre l'Honorable Dorothy Shephard, ministre de la Santé, la présidente directrice générale du réseau de santé Vitalité, le Dr. France Desrosiers, et le président directeur général par intérim du réseau de santé Horizon, le Dr. John Dornan, seront présentes. Minister Shephard.
Good afternoon, bonjour. I was deeply saddened today to learn that 5 more New Brunswickers have passed away as a result of COVID-19. And I would like to share my sincere condolences with the families who are now mourning the loss of their loved one. Every time we learn that more people have lost their life because of the virus, it is incredibly difficult, and I know all New Brunswickers are feeling the impact of these losses. Today, there are 40 new COVID-19 cases and 67 recoveries. I am pleased to see that the number of recoveries is higher than the number of cases. This is a positive trend that will hopefully continue. For more information about today's cases, they can be found in our daily news release, which will be available on the GNB website. Today, I am pleased to be joined by Dr. France Desrosiers of Vitalité Health Network and Dr. John Dornan of Horizon Health Network. I know New Brunswickers have questions about cases and outbreaks in hospitals, as well as the impact of COVID-19 is having on other appointments and services within the regional health authorities. The CEOs will speak to these concerns shortly and will also respond to questions from the media. Before they begin, I would like to provide a few updates, beginning with the vaccination status of Government of New Brunswick employees. Just over 2 weeks ago, on October 5th, we announced that all public service employees, including those in the civil service, education system, healthcare system, and Crown corporations, must be fully vaccinated by Friday, November the 19th. If they are unable to show proof of full vaccination by that date, they will be sent home without pay. Since we made that announcement, I am pleased to report that there has been significant improvement in the number of employees who have gotten fully vaccinated. On October the 5th, 18.9% of our employees were not fully vaccinated. This week, the data shows that 13% are not fully vaccinated. This means that we have seen 6% increase in fully vaccinated employees with a little more than 2 weeks to go. Across the 4 parts of the public service, there are approximately 59,500 employees. This includes part-time, casual, and term employees. Almost 52,000, or 87% of public service employees, are now fully vaccinated. This is very positive news, and I want to thank everyone who has stepped up and done their part. About 650 employees, or 1% of the public service, are partially vaccinated, and I am optimistic they will all get their second shot soon. However, I am troubled by the 7,000 employees, about 12% of the public service, who are still completely unvaccinated. We simply cannot afford to have unvaccinated people working in New Brunswick's public service. The potential risk to coworkers, patients, students, and members of the public is too high. After today, those who have not had at least 1 dose of the vaccine will not have enough time to get their second dose before the November 19th deadline, as 28 days must pass between doses. This means they will spend at least some time home from work without pay. Still, I urge all public service employees who have not yet received a dose of the vaccine to book their appointment immediately. If you start the vaccination process now, you can reduce the length of time you will be at home without pay. I also recommend those who have had only their first shot to book their second dose appointment as soon as they are eligible to make sure that they do not have interruptions in their income. I remain hopeful that in the next month, more people in the public service will choose to get vaccinated. To those who have not yet booked an appointment, I remind you that you alone have the power to continue to do your important work after November 19th in serving the people of New Brunswick. All you need to do is get vaccinated, protecting yourself, your loved ones, your colleagues, and the people who interact with you each day from a virus that we know can cause serious illness and death. I also want to say that if you are having hesitancy about the vaccines available, please reach out to your medical provider or 811. I am optimistic that after weighing the consequences, more people will choose to do the right thing in the next 4 weeks. I also want to let New Brunswickers know that our government is working closely with the federal government and other provincial and territorial governments to develop a standardized proof of vaccine. This will help facilitate international travel, and it can be used in jurisdictions across Canada when accessing businesses, services, and events where proof of vaccination is required. To date, we have met all of our developmental milestones, and we expect that the public will be able to download a QR code proof of vaccination credential by mid-November. This proof of vaccination code will be accessible on any electronic device, and it will also be printable. I know people are wondering what Halloween will look like this year, and we now have guidelines available for trick-or-treaters. Public Health is recommending that residents who wish to trick-or-treat in non-circuit breaker areas should only travel with their single household plus up to 20 consistent contacts. In circuit breaker areas, trick-or-treaters are limited to traveling with a single household. In all areas of the province, people handing out treats should do so through touchless means. More information about Halloween guidelines is available on the GNB coronavirus website. And finally, in an effort to better align our approach across government, we have reviewed guidance regarding school sports and extracurricular activities. We recognize the important role that sports and other extracurricular activities play in the lives of our students by supporting their physical, social, and emotional well-being. As of today, teams and extracurricular groups will be permitted to travel within New Brunswick. This includes travel in and out of circuit breaker communities for games. Students under the age of 12 in circuit breaker communities will also be able to resume school sports and extracurricular activities, following the healthy and safe school guidelines. All of these activities continue to be subject to guidance provided in the mandatory order. Spectators can attend school-related events that are held outside of school facilities if they show proof that they are fully vaccinated and following masking and physical distancing requirements. Beginning Friday, October 29th, spectators will be permitted to attend sports and extracurricular activities within school buildings, provided they follow masking, physical distancing, and any other operational requirements set out by schools or districts. All events will require the cooperation and support of families and community volunteers. If schools are not able to find enough community volunteers to manage events, individuals, schools, and school districts may choose not to allow spectators. I want to thank schools, students, and parents for their continued patience as we work to find the best possible balance to allow students to continue to participate in activities while still keeping them healthy and safe. I would now like to invite Dr. Desrosiers and Dr. Dornan to provide their updates on New Brunswick's hospitals. Thank you. Merci.
Merci, Madame la Ministre, pour cette invitation à participer à la conférence de presse dans le but de vous présenter un rapport de situation pour le réseau de santé Vitalité en lien avec la COVID et ce qui se passe dans nos établissements. Alors, j'aimerais quand même prendre quelques instants pour partager mes sincères condoléances aux proches et aux familles de notre centaine de patients décédés à ce jour de la COVID dans notre province. Je vous transmets des pensées positives et de l'affection sincère de la part de toute mon équipe et moi-même. La quatrième vague de la pandémie frappe le Nouveau-Brunswick avec une intensité que peu de gens avaient prévue. Les hôpitaux du réseau sont passés au niveau d'alerte rouge le 12 octobre dernier, comme vous le savez. Concrètement, ça veut dire que tous les services de soins de santé non essentiels sont réduits ou interrompus temporairement. Et je vous donne des exemples. Services de professionnels comme la physiothérapie, l'ergothérapie, la nutrition clinique, le service d'imagerie médicale non urgent, les chirurgies électives et j'en passe. Et nos priorités sont de maintenir les services essentiels suivants, soit nos services d'urgence, nos chirurgies urgentes, nos soins intensifs COVID, nos soins intensifs non-COVID, les unités régulières de soins COVID, le dépistage de la COVID dans un délai de 48 heures et la vaccination de la population contre la COVID. Alors, le passage au niveau d'alerte rouge était nécessaire afin de pouvoir réaffecter du personnel pour maintenir ces services prioritaires. Et jusqu'à présent, la réaffectation du personnel donne de bons résultats et je tiens à souligner la collaboration exceptionnelle, le professionnalisme et l'engagement de toutes nos équipes de soins. Le passage au niveau de l'alerte rouge a des répercussions, par contre, sur notre offre de services, mais malheureusement, surtout sur nos patients. Alors, pour vous donner quelques exemples concrets, depuis l'instauration du niveau d'alerte rouge, le réseau a dû reporter plus de 2000 rendez-vous en imagerie médicale et plus de 515 chirurgies électives. Pour une seule journée, par exemple, si je prends mercredi dernier, c'est 55 chirurgies électives qui ont dû être reportées. C'est 55 citoyens au Nouveau-Brunswick qui devront malheureusement attendre un peu plus longtemps pour une chirurgie dont ils ont besoin pour améliorer leur santé et leur qualité de vie. C'est difficile pour eux et nous en sommes très conscients. Il faut aussi préciser qu'en date d'aujourd'hui, le réseau compte 59 travailleurs de la santé qui sont retirés du travail, dont 19 qui portent un diagnostic de COVID. Nous avons 25 patients actuellement atteints de la COVID dans nos établissements, dont 5 sont dans les soins intensifs. Et nos taux d'occupation dans nos hôpitaux demeurent très élevés, en moyenne dépassent le 100% partout. En plus, nous gérons une éclosion à l'interne de l'hôpital régional de Campbellton, dont je vais vous parler un petit peu plus loin. La situation est évaluée sur une base régulière, en fait, de façon hebdomadaire, et pour toutes ces raisons, le réseau a décidé de maintenir son niveau d'alerte rouge dans tous ses hôpitaux pour au minimum une autre semaine. Les choses évoluent rapidement et nous estimons qu'à l'heure actuelle, il y a trop de facteurs inconnus pour nous prononcer sur ce qui pourrait arriver à plus long terme. Dès qu'une décision sera prise de passer à un niveau d'alerte inférieur, c'est certain qu'on va communiquer avec notre population. Donc, à propos de l'éclosion de la COVID à l'hôpital régional de Campbellton, depuis le début de l'éclosion, on compte 17 patients qui ont été infectés, dont 4 sont malheureusement décédés des suites de la COVID. Encore une fois, nos plus sincères condoléances aux familles éprouvées. 37 travailleurs de la santé sont devenus positifs également. Et la situation à l'hôpital régional de Campbellton illustre très bien à quel point un seul cas d'infection acquis dans un hôpital peut paralyser un établissement au complet, puisqu'il faut retirer les travailleurs de la santé et prendre des mesures pour éviter la propagation. La bonne nouvelle dans tout cela, c'est qu'aucun nouveau cas n'a été déclaré dans l'établissement depuis le 20 octobre, donc les choses évoluent dans la bonne direction. Il y a de l'espoir et les moyens pour y arriver sont clairs. Comme société, comme système de santé, chacun de nous, comme citoyens et citoyennes, nous devons maintenir et rehausser les mesures sanitaires de la santé publique. Et la vaccination est certainement une pièce maîtresse dans notre lutte à finir contre la COVID. Je suis encouragée de voir que les taux de vaccination augmentent de manière continue, autant au niveau de la population en général que chez nos travailleurs de la santé. Donc, par exemple, en date du 11 octobre dernier, 83% des travailleurs du réseau étaient pleinement vaccinés et 87 avaient reçu au moins une dose. Et nous allons être en mesure de dévoiler de nouvelles données en début de semaine prochaine. Mais si on suit les tendances, on a bon espoir que le taux de vaccination pour au moins une dose va dépasser le 90%. Alors, c'est une très bonne nouvelle. Mais il est important de tous se rappeler qu'une personne pleinement vaccinée contre la COVID qui développe quand même la maladie sera beaucoup moins malade qu'une autre personne qui n'est pas vaccinée. Alors, les personnes vaccinées auront beaucoup moins de symptômes, des symptômes plus légers, et si elles doivent tout de même être hospitalisées, elles ont beaucoup moins de risques de se retrouver aux soins intensifs. L'impact positif de la vaccination pour nos travailleurs de la santé est aussi immense, donc en plus des avantages que je viens de vous partager, un travailleur de la santé vacciné peut être amené au travail de façon sécuritaire beaucoup plus rapidement comparativement à un travailleur de la santé non vacciné. Je me dois de vous souligner un autre enjeu qui est très préoccupant actuellement pour le réseau de santé Vitalité et ses partenaires. C'est la possibilité de débrayage des employés du syndicat canadien de la fonction publique qui sont en position légale de grève depuis déjà un certain temps. Alors, au réseau de santé Vitalité, cela représente environ 36 % de notre force ouvrière. Évidemment, nous avons des plans d'urgence en place et l'ensemble de nos gestionnaires sont prêts à un éventuel débrayage dès la réception d'un avis officiel d'une grève. Mais malgré le fait que près de 70 % de ces travailleurs occupent un poste étant désigné comme essentiel, ça veut dire qu'en cas de débrayage, ces employés-là devront se présenter quand même au travail et effectuer leurs tâches habituelles. Malgré ce fait-là, un débrayage aurait un impact très significatif sur le réseau qui fonctionne déjà en phase d'alerte rouge avec des réductions de services importants partout et qui subit une pression constante par les exigences de soins qui entourent les unités COVID, les centres de dépistage et les centres de vaccination. Alors, l'objectif du réseau continuera d'être le maintien des services jugés essentiels malgré une grève éventuelle et la sécurité des patients demeurera évidemment notre priorité. En terminant, je tiens à remercier l'appui du ministère de la Santé, ainsi que de nos partenaires comme le Réseau de santé Horizon et Ambulance Nouveau-Brunswick. La collaboration entre tous les joueurs du système de santé est vraiment excellente et c'est ça qui va nous permettre de passer à travers cette tempête. Il faut continuer nos efforts, portons nos masques, lavons-nous les mains, respectons la distanciation physique, surtout faisons-nous vacciner. C'est de cette façon qu'on va pouvoir prendre soin de nos communautés, de nos familles que nous aimons, tout en permettant à notre système de santé de poursuivre sa mission. C'est tout pour moi. Merci.
Good afternoon, everybody. Hello, bonjour. Over the course of the pandemic, our public health care system and our hospitals have served as the last line of defense against COVID. Right now, our healthcare system is under immense amount of strain, and the impact of COVID-19 has played no small part. During the fourth wave of activity, we have seen a rapid rise in hospitalizations, ICU admissions, and people presenting to our emergency departments. Certainly our primary care colleagues with the aid of virtual care are stepping up, but still at the end of the day, our hospitals had to be open to take people that for a host of reasons they'd like to come to our hospitals, maybe not have family doctors, and our ERs are overflowing. Additionally, while we are currently dealing with a COVID outbreak, we have specific outbreaks in our hospital, specifically the Moncton Hospital. This has occurred on our oncology units and our general surgery units. Currently, it's impacted 14 patients and 11 of our staff. It has reduced access to surgeries and chemotherapy treatment in some of our patients. Currently, there are 30 COVID-positive patients in our hospitals. Of these 30, 9 have been admitted to the intensive care unit. Approximately 80% of these COVID admissions are folks that have not received vaccinations. The 20% that have received vaccinations are people that are otherwise ill, have concurrent diseases, chronic diseases, and then you put even a small dose of COVID on top of that, it can make people very ill. Our hospitals are full. Ideally, a hospital would function at approximately 85% occupancy with some buffer room. Our hospitals are mostly well over 90% occupied currently. We are seeing levels of care that has been challenged to the point where we had to move people from one area to another. Our goal is to provide safe, effective, and quick care to those patients that are in our hospitals, and it means that we, like Vitalité, have had to redirect some of our, say, non-urgent care from the operating rooms to our hospital inpatient units. Therefore, we have had to cancel a number of, I'll say, non-emergent, or what some folks call elective surgeries. There's no such thing as an elective surgery. You don't wake up and say, I think I elect to have surgery today. Elective surgery just means that it does not need to be done within the next 24 or 48 hours. And to be clear, while the term elective is used, every single surgery is assessed, covered by our healthcare system, and is necessary. Thus far, we've had to delay and in some instances cancel a total of 113 surgeries. The impact is felt throughout New Brunswick, throughout Horizon. 71 of those postponed surgeries are occurring in the Fredericton and Upper River Valley area, 42 in the Moncton area, and in St. John, which is not currently in a circuit breaker, we are also postponing surgeries. And why are we doing that? Well, the folks that work in our operating theaters are needed in other areas, simply put. We need them on inpatient units, on ICUs, and in the emergency departments. The stress there can be mitigated to some extent by an increase in staff that will work there. Why are we canceling surgeries? Well, you know, before COVID, sometimes we had staff difficulties, but we were able to juggle surgeries, juggle the types of surgeries that we do, but COVID has thrown a huge wrench into that. Sometimes surgeries are canceled because of patients. You know, we know now that COVID is in some of our hospitals, some staff, some patients. And so, as was the case with our first red phase a while back, patients are nervous to come to our hospitals. That results in them delaying their surgeries, and in some instances, the condition that is being treated gets worse. We are always very concerned that post-COVID, post-red phases, people's diseases progress to the point that when they come back, it's a more serious problem. In the Moncton Hospital, as I noted, more than 30 surgeries have had to be canceled because of a freeze on admissions and transfers to a general surgery unit that is currently part of an outbreak. In our oncology units, most of our chemotherapy occurs as outpatients, but some requires inpatient care. And when we have a COVID outbreak in an oncology unit, you can anticipate the results. For the moment, the virus arrived in our province. We have had very good cooperation with Vitalité. As an example, our heads of ICU communicate on a very regular basis so that if one hospital is inundated in their ICU, we can consider resources in other hospitals throughout the province across our regional health authority boundaries. Sometimes we have to make difficult decisions with respect to all aspects of our hospital care, and this is a very sensitive process. We also have to weigh the risks and benefits of doing nothing, and generally speaking, that's just untenable. There's no playbook for how we respond to COVID, and so many times while we look at the experience in other areas and try not to replicate the bad experiences, we don't have clear literature or evidence on how we move forward. Certainly in the Canadian environment, we have seen strategies that perhaps have not worked as well. We know how quickly the Delta virus can spread, and the rising number of new cases and hospitalizations gives credence to that. We also know that COVID doesn't appear magically. It's like a proverbial Trojan horse. It enters our hospital in disguise, on the back of your hand, on your body when you are completely asymptomatic. And then you become positive and you spread it to a friend or an inpatient, and they spread it to somebody else, and then they spread it to staff. What we need to do is break that Trojan horse axis. And this is why, as part of our red phase, we have significantly limited access to anybody, visitors, support workers and the like, or support personnel and the like. Now, this is not easily done. We know that for people to get well, they need the support of friends and families. To admit someone into our hospital to have no impact with the outside world, no physical impact with the outside world, is difficult. So currently we are restricting access considerably, but we look at that on a very regular basis. At the end of the day, we would like to be able to welcome visitors back as soon as we can do so safely. I'd like to let you know that effectively today, Horizon is extending its red phase alert, which means significant reduction in visitors, reductions in non-urgent surgeries. And we're going to be doing that for another week to 2 weeks. And we will, like Vitalité, assess it on a weekly basis, but to give it some bookends, we are considering a 2-week period at this point in time. Visitor restrictions will be in place, as was the case in early October, October the 8th. This is the only way that we can keep COVID from entering our institutions. I would like to speak a little bit to what's happened in Moncton, and we are alarmed, but once the Trojan horse gets in, I can reassure people that we have an effective team at walling off that Trojan horse so that we can contain the virus into 2 outbreak areas. It's not getting out of there. Our team now knows what to do when the Trojan horse gets into the hospital, and we are very pleased that this is the type of practice and that we've been ready for and will put into place in all of our facilities. It's a test of our system. Thus far, nobody's died with this particular outbreak. We have staff and patients that are recovering, and we're pleased to report that. And as noted, in cooperation with our partners in government, Ambulance New Brunswick, Vitalité, we will be reassessing our red alert situation in succeeding weeks. I'd like to remind people to be kind to each other. One of the difficulties in our process is that people have to help us screen patients in our communities. Peace officers help to enforce the rules that the mandatory order and other circuit breaker activities have caused. These are folks that are trying to help preserve the health of our population. Be respectful. They're not doing it out of random activities. So when you come and you're approached by a screener, be pleasant, be kind, be friendly, answer the questions. If they say, well, maybe you shouldn't come in today, they're doing it for good reasons. If a peace officer is involved with you, they are doing it for good reasons. If you're in a gathering that is too large, for example, the peace officer will give you some advice about what not to be doing. Moving forward, we would like to be transparent. We would like our community to be made aware of what we're doing as quickly as is possible. Our decision to stay red occurred today, and you are hearing it a few hours after the decision has been made. We will continue to try to do that. Sometimes we're criticized by being administrative people and not being aware of what's happening on the front line. Nothing could be further from the truth. Dr. Desrosiers and I are physicians. We have seen what it's like on the front line. Our other leaders have been clinical people who know what it's like to be on the front line. And I think that we live what we preach in terms of COVID restrictions. I do want to remind people about the safety of COVID vaccines. People are tired of hearing me and others say that it's safe. Talk to people that you know and trust. Don't get all your information from the internet in the southern US, for example. Talk to nurses, practitioners, physicians, nurse practitioners, pharmacists, people that have information and keep abreast on a daily basis about the value and the ups and downs of vaccinations. We are using that strategy with our staff. People that have any questions or anxieties, we are encouraging them to talk to their healthcare providers and other people that might be better informed. Thank you very much for your time today. I do appreciate us having an opportunity to speak to you publicly, and we will continue to do that around press releases. Keep abreast of our Horizon bulletins, our websites that talk about changing processes, and thank you very much for your time today. Merci.
Merci beaucoup, Ministre, Doctors Desrosiers, Dornan. Thank you, Minister. Thank you, Doctors Dornan and Desrosiers. We will now proceed to question period with members of the media. You have the right to pose your question in the official language of your choice. Nous allons maintenant procéder aux périodes des questions avec les membres des médias. Vous avez le droit de poser votre question dans la langue officielle. Laura Brown, CTV.
Hi there. I was hoping that both CEOs could answer or tell me how many COVID patients right now are on ventilators.
Du côté du réseau de santé Vitalité, au CHU du Monde, nous avons un patient de ventilé. À la zone d'Edmundston, nous en avons également 2. À la zone de Bathurst, 1.
Merci.
Thank you for the question. We have 50 hospital admissions. 15 are in ICU in the province. 8 are in ICU in Horizon. 7 are on ventilators.
Thank you. Ms. Brown, do you have a quick follow-up?
Yes, I'm wondering if you can tell me how many ventilators we have in the system. Do we have enough at this point?
I'm going to take that one, Laura. We have ample. We have more than our evening use in our hospitals, and we have spares.
Thank you both. Pascal Rochnog, Radio-Canada.
Bonjour, ma question est pour la ministre Shephard. J'aimerais juste qu'elle clarifie, elle a mentionné qu'il y a 59 000 employés dans les 4 parties de la fonction publique. Quelle partie de ces employés-là, combien d'employés sont visés par la vaccination obligatoire exactement?
Merci pour question. There are 59,500 employees in the civil service, and that includes part-time casuals and full-time employees. 52,000, 87%, are fully vaccinated. So we have approximately 7,000 employees, or 12% of the public service, who are not vaccinated at all.
Merci. Monsieur Rochnog, as-tu un suivi?
Oui, ma question, c'était pour savoir quelle est la partie, combien d'employés de la fonction publique doivent être pleinement vaccinés le 19 novembre?
We are not moving from our goal of every civil service being vaccinated or sent home without pay.
I think there was maybe a problem in translation. I was just wondering what part of the 59,000 public service employees will have to be fully vaccinated on November 19th if they want to avoid being sent home without pay. So how many of those 59,000?
I think I understand all of them need to be vaccinated in order to not be sent home without pay.
Got it,
Okay,
thanks.
merci. Natalie Sturgeon, Global TV.
Thank you. This question is for both CEOs. I'm just wondering, yesterday Premier Higgs said 6% of those cases that we're seeing will be hospitalized. I know we're seeing a drop in those daily cases, and recoveries are more than that. But how long can it sustain that 6% while continuing to offer other services, although limited under the red level?
Thank you very much. If things didn't change, if we had the same level of hospital admissions as we have now, no more, no less, and we continue to not provide all the surgeries that we want to do or the chemotherapy that we want to do, we could sustain indefinitely. That's not what will happen. Cases can grow. We are in the midst of possible labor action, and it's not acceptable to not do the surgeries that we want to do. So in red, it's not an optimal environment. We need to get back to yellow so that we can do the urgent surgeries and the non-urgent surgeries so that we can clip away at people that have been waiting in extraordinarily long periods of time for their surgery. So if things didn't change, we could sustain red, but it wouldn't be at the best of our abilities.
Ms. Sturgeon, do you have a follow-up?
Yes, Minister Shephard, of those 7,000, if they don't in the next day or so get those vaccines, is it going to cause issues within the public service to have those folks out waiting to be vaccinated?
I have to say, of course, the individuals unvaccinated range anywhere from payroll entry to front lines of our hospitals, to our education staff. So it will definitely have an impact, but we have to have a steady line of understanding that this is very necessary for the protection of everyone.
Thank you. Eloise Rodriguez, Radio-Canada.
Bonjour, ma question est pour les PDG des deux réseaux. Dans le fond, j'aimerais que vous me donniez un peu une idée de, en ce moment, la phase rouge, les contraintes sur les hôpitaux. Est-ce que c'est la pire situation qui a été vue par les réseaux de santé depuis le début de la pandémie? À quel point la situation est critique en ce moment?
Tel que mon collègue l'a mentionné tantôt, être en phase rouge n'est pas une situation idéale. C'est une situation nécessaire pour procurer les services essentiels et urgents. Ce n'est pas une couleur de phase que l'on doit maintenir longtemps pour la sécurité de notre population au Nouveau-Brunswick. Nous le faisons pour s'assurer que les services les plus essentiels sont offerts, donc les services prioritaires. Nous nous devons de retourner en phase orange et en phase jaune le plus rapidement possible. Et ce sont vraiment les mesures de santé publique qui seront respectées, qui nous aideront à atteindre notre but. Est-ce que tu veux ajouter quelque chose, John?
Non. Merci, Dr. Desrosiers. Héloïse, as-tu un suivi?
Oui, est-ce que vous pouvez juste clarifier à ce moment-là, c'est quoi les critères qui vont vous guider pour les retours en phase orange et jaune?
Alors, c'est toujours une question de gestion de risque, de transmission communautaire, de capacité en ressources humaines, donc le nombre d'hospitalisations COVID, la quantité de dépistage nécessaire à faire dans les centres de dépistage, la quantité de vaccins à offrir à la population et évidemment le nombre de patients admis soit aux unités COVID ou aux unités de soins intensifs COVID qui vont déterminer notre capacité à retourner en phase orange.
Merci. Isabelle Legier, CBC.
Hi, my question is probably best addressed to either Dr. Desrosiers or Minister Shephard. I don't believe we heard about the outbreak at the Campbellton Regional Hospital prior to yesterday. We only knew about the one at the Restigouche Hospital Center on October 6th. What can you tell us about both of these outbreaks, including the number of confirmed cases in patients and staff, and the impact on services?
J'ai donné tantôt toutes ces informations-là. Pour la zone Restigouche, c'est le même équipe médicale et nursing qui offre les soins au centre hospitalier Restigouche comme à l'hôpital régional Restigouche. Donc, les chiffres que j'ai partagés tantôt incluaient les deux centres. Et j'ai parlé de 37 travailleurs de la santé qui sont devenus positifs à travers cette éclosion. Il y a actuellement 17 patients qui ont été infectés à travers l'éclosion et 4 qui sont décédés. Et la bonne nouvelle, c'est que nous n'avons eu aucun nouveau cas positif au centre hospitalier Restigouche depuis 10 jours et à l'hôpital régional de Campbellton depuis le 20 octobre. Donc, les mesures qui ont été prises pour éviter la propagation donnent les résultats désirés.
Merci. Ms. Legier, do you have a follow-up?
Yeah, so this one would be best addressed to the other CEO, Dr. Dornan. You've provided an update on the outbreaks at the Moncton Hospital's Cancer and General Surgery unit, but we still haven't been given any update on the outbreak in the geriatric unit declared on September September 27th, including whether it's linked to the other two, the total number of patients and staff involved, and the impact on services. What can you tell us about that?
We have not declared an outbreak outside of the two surgical areas and the oncology area. There are sometimes cases in other areas that don't meet our definition of an outbreak. A single case, for example, in a COVID unit or in another area of the hospital is not an outbreak. So thus far, we are limited to only 2 outbreak areas. Now, that begs the question, what about the Moncton Hospital? Is this an outbreak hospital? And we have reviewed our definitions, and it's a hospital under duress. And we have managed that, but we have not had outbreaks in other areas currently.
Thank you. Bobby Jean McKinnon, CBC.
Yes, thank you. Can you hear me okay?
Yes, thank you.
Thank you. Dr. Dornan and Dr. Desrosiers, Dr. Russell said yesterday that most of the 23 fully vaccinated people hospitalized with COVID contracted the virus after they were hospitalized for other reasons. Because of the outbreaks in the Moncton Hospital and Campbellton Regional Hospital. What is the actual number and how is this happening and what's being done to improve the protocols to ensure it doesn't continue?
This is a very timely question. When people go to the hospital, they have some assurances that they're safe, that they're not going to get sicker. And when folks get COVID after they've been in the hospital, we call it a nosocomial infection. And the measures that we take are to, first of all, stop people from coming into the hospital. The infections in our hospital were borne by visitors, by that Trojan horse. So this is what we're doing acutely. Secondly, we are increasing the screening that we are doing of people that come in. We poll people twice a day, ask them for COVID-related symptoms. Thirdly, we recognize that even those measures still allow the Trojan horse into the hospital. We practice very good droplet precaution, hand washing, masking religiously in all our units, and those maneuvers already have reduced any further spread in the hospitals that have had positive patients.
Ms. McKinnon, do you have a follow-up?
Yes, I do. I guess for both of them again, please. It sounds like you're already stretched very thin, and it sounds like hundreds, if not thousands, of healthcare workers will be sent home on November 19th. So what sort of contingency plans do you have in place?
Well, it's somewhat like what we were doing in a pending strike action. We're trying to get ready to see what that would look like, number one. Number two, mitigate that. Right now, in Horizon, for example, we're looking at approximately 1,200 people that have not been fully vaccinated or told us their vaccination status. We're still working on that 1,200. We're setting in place an opportunity for people to discuss anxiety around vaccination, people that have not had their questions answered, for example, even amongst our healthcare workers. So we're not stopping at that number of people going out on the 19th. We're also hopeful that, should people choose to leave, that others will step up, and that ultimately people will recognize and talk to people and understand the safety of vaccination and what it does for your colleagues and your patients. It's one thing to say, well, I'm going to take a personal risk. It's another thing to bring COVID into our institution and be responsible for a nosocomial infection. That's just not in the cards. So we think that ultimately people that work in our system, which are caring people, will recognize the value in being vaccinated. So we haven't let that go. We're still working on those last few people.
Thank you, Doctor. Thank you, Ms. McKinnon. Savannah Odd, Telegraph Journal.
Hi, can you hear me okay?
Yes, thank you, Ms. Odd.
My question is for both Dr. Desrosiers and Dr. Dornan. You mentioned, at least Dr. Dornan mentions that these outbreaks in the hospital started with a visitor. Can you tell me a bit about what public health safeguards failed there and maybe what you've learned from that? Have you refined your processes since then?
Merci pour la question. En fait, c'est une question bien intéressante et je n'oserais jamais diagnostiquer que l'éclosion interne a été causée par un visiteur. Quand on fait face à une situation de transmission communautaire, c'est extrêmement difficile d'identifier le cas index dans une éclosion à l'intérieur d'un hôpital. Il y a trop de scénarios possibles pour pouvoir identifier clairement le cas index. Donc, ça peut être toutes sortes de scénarios comme la présence d'un visiteur infecté, la présence d'un patient qui est admis pour une raison non COVID, qui est dépisté à son admission, parce que ça, c'est une des mesures qu'on met en place par précaution, que le premier dépistage est négatif. Au courant de son séjour, le dépistage sérié qu'il reçoit, il y en a un qui devient positif. C'est impossible de savoir s'il devient positif pour un contact intra-hospitalier ou parce qu'il s'est positivé à partir d'une maladie qu'il aurait contractée dans la communauté avant d'être admis. Alors, je vous pince ce tableau-là que pour vous que vous puissiez imaginer la quantité de scénarios potentiels qui ne nous permet pas d'identifier le cas index. Alors, ce qu'il faut faire, c'est exactement ce que Dr. Dornan vous a partagé tantôt et ce qu'on fait en continu, c'est-à-dire d'éviter que des gens se présentent dans nos hôpitaux non vaccinés, c'est-à-dire de porter le masque, de se laver les mains, la distanciation physique. Et par la suite, à chaque fois qu'on admet des patients, on les dépiste, qu'ils soient symptomatiques ou pas. S'ils deviennent symptomatiques, évidemment, on les dépiste encore plus et on les isole. Si on utilise des appareils qui génèrent des aérosols, on porte des protections supplémentaires comme les masques N95 et les protections oculaires. Quand on a des éclosions à l'interne, évidemment, on va fermer des unités à toutes les visites. On va s'assurer de questionner tracer tout le personnel qui est en contact avec les patients qui sont devenus positifs pour eux-mêmes les isoler à la maison et les suivre de près et les dépister de façon régulière. Alors, ce sont toutes des mesures qu'on met en place. J'espère que j'en oublie pas. Nous avons toutes ces mesures-là sur nos sites web et c'est facile de vous les procurer si vous voulez les avoir en détail. Mais de toute façon, ce que je voudrais vous dire, c'est que nos mesures semblent porter fruit, puisqu'à l'éclosion, par exemple, à l'hôpital de Campbellton, qui date d'un peu plus longtemps que celle de Moncton City, on n'a pas de nouveaux cas depuis plusieurs jours. Et je pense que ça démontre qu'on a mis les bonnes mesures en place pour contrôler l'éclosion à l'interne.
Thank you. Merci beaucoup. Ms. Odd, do you have a follow-up?
I do. Thank you, Bruce. This one's for Minister Shephard. I'm wondering if you know how many of the approximately 7,000 unvaccinated or workers who haven't started getting their vaccine as of today are in the health system specifically? And does your total factor in long-term care workers who are also under this deadline? Do you have a sense of that population as well and their vaccination status?
Yeah, I should have brought that slide with me, Savannah. We know that, I believe, if I'm not mistaken, Horizon has about 1,200 employees, Vitalité.
What do you need?
The number from Vitalité that are not vaccinated?
Yeah, it's 11% of 8,300.
Okay.
I will let you do the.
So it's about 1,000, couple hundred for Vitalité. I do not have the healthcare or the long-term care sector. However, I will say this: I know that it has increased to well over. I think it's at 87%. Or for the long-term care sector. So there have been significant improvements over the last 2 weeks. I apologize for not having those exact numbers, but if you need them, we will get them for you.
Thank you. Jean-François Boisvert, l'Acadie Nouvelle. Jean-François?
Je pense qu'il n'est pas en ligne, Bruce.
OK, merci. Alexandre Boudreau.
Oui, merci. Donc, ma question serait pour les deux PDG. Donc, comme vous l'avez mentionné, la grève se pointe le bout du nez. Là, ça semble assez inévitable bientôt. Puis il y a aussi des travailleurs qui devront quitter le travail bientôt parce qu'ils ne sont pas vaccinés. J'aimerais entendre un peu plus de détails sur l'impact que ça va avoir sur les services dans le pire des cas où il y a une grève et des employés qui manquent au travail en même temps. Quelles sont vos prévisions par rapport aux réductions de services exactement? J'aimerais entendre peut-être des exemples.
Merci pour la question et la réponse est un peu complexe, fait que je vais essayer d'être le plus simple possible. D'abord, il faut comprendre que pendant une grève, il y a des positions qui sont identifiées, désignées essentielles. Et actuellement, à peu près 70% de ces travailleurs détiennent des positions désignées, ce qui fait qu'au niveau clinique, on aurait une capacité de maintenir le niveau de soins qu'on offre actuellement et qui est sous-optimal, je le rappelle, pour environ 10 à 14 jours. Par contre, il y a d'autres secteurs qui ont pris naissance à cause de la COVID, qui ne sont pas des secteurs désignés et qui mettent le système de santé à très haut risque s'il devait y avoir une grève. Alors, je parle de tous les secteurs comme celui de la vaccination, le dépistage, la sécurité entourant nos portes pour contrôler les visiteurs dans nos établissements, et évidemment, tout nouveau service associé à la pandémie COVID. Donc, tous ces secteurs-là vont faire qu'on pourrait difficilement survivre plus de 2 à 3 jours s'il y avait une grève qui était déclenchée la semaine prochaine.
Donc, ces travailleurs-là, dans ces secteurs-là, il n'y a aucun des travailleurs qui est désigné essentiel, si je comprends bien.
Dans les services en lien avec la COVID, il n'y en a aucun à l'heure actuelle.
Est-ce que le docteur Dornan voulait ajouter quelque chose?
Ça en vient.
Merci pour la question. Strike is not just healthcare, it includes education. And we consider what that does for unions and activities that are adjacent to us. If there was a large strike, for example, in education, and our employees that had young families had to stay home to look after children, that would impact us quite significantly. And as Dr. Desrosiers says, at this point in time, there are some services, particularly COVID services, that we don't have designation on our employees. You know, what would it look like if we stopped testing, stopped providing vaccination? Untenable. And then you look at within our hospitals, how are we able to reduce or survive with a reduction in services? It's not like if we go to essential services of, let's say, 67%, that our care just goes back 60 to 70%. It's magnified. If you don't have people to enter payroll data and people don't get paid, intolerable. We look at environmental services. You know, yes, we could tolerate a chip bag on the floor, but could we tolerate growth of all our disposable outfits that we use, PPE in our hospitals, because of the growth in that? So we try to visualize what it looks like, an environment where some employees are going to be going off work in these next few days. And then if we're cut back to essential employees by 60, 70%, and then the impact of education having in our hospitals, it's almost untenable. So a labor action will have significant impact on our ability to deliver even the rudimentary necessities of care.
Thank you both. Merci à vous deux. Monsieur Boudreau, as-tu une question très, très rapide? Une deuxième suivie?
Oui, merci pour vos réponses. Peut-être que la ministre peut répondre ou les PDG. Par rapport à vos plans d'urgence en place en situation de grève, est-ce que vous pensez, par exemple, faire appel à l'armée pour staffer certains services, pour fournir certains services, par exemple?
I've been so proud of Horizon, Vitalité, EMA and B, and how they have been collaborating over these last several months. It is really truly shown that we are operating as a provincial sector. And what I can say to Labor Actions is that we will work together the same way we've been working over these past few months to ensure that we are delivering safe services. That is paramount. Services will be affected, but I rely on the guidance of our CEOs at Horizon, Vitalité, and EMA and B to guide us through the situations that are going to arise. There are absolutely plans in place, and I have full confidence that they will help us make decisive, very quick decisions in how we respond to situations.
Thank you.
But do those plans include calling upon the armed forces, for instance?
Well, they don't today, but we will do whatever is necessary to ensure the safe protocols within our institutions.
Thank you. Trevor McNally, Campbellton Tribune.
Thanks, Bruce. My question is for Minister Shephard. Why is the COVID-19 dashboard showing 100% vaccinations in some age groups when a number of nursing homes are reporting some people in those age groups have no vaccines at all?
Sorry, Tim, could you repeat that? It was quite hard to hear you.
Oh, sorry. How about now?
Better?
Okay, why is the COVID-19 dashboard showing 100% vaccination rate in some age groups when a number of nursing homes are reporting that some people in those same age groups aren't vaccinated at all?
Well, I am going to tell you that we have sometimes the other provinces may have been vaccinated here, and so the numbers could be skewed slightly. But we will certainly endeavor to ensure that there is as much accuracy as possible. The most important thing to know is that those who are unvaccinated are certainly known, and we work with families and residents to ensure that we get as many vaccinated as possible. So it can be. So we'll definitely reconcile our stats for you, but I think it's just a little bit of a glitch.
Thank you. Mr. McNally, do you have a quick follow-up?
Sure do. What is the vaccination rate for each health zone, and why isn't that data on the dashboard rather than just the breakdown of the ages?
I don't have the map here with me today, but we can certainly get you those stats. Why isn't it on the dashboard? It's probably just about trying to keep the information tight, but certainly it's not information we would hold back. We'd be happy to get it for you.
Thank you. Danielle Edwards, Canadian Press.
Hi, I just have a question that's best
Ms. Edwards, can you speak a little louder, please?
Okay, yes, is that better?
Thank you, yes.
Okay, yes, I have a question that's best directed to the Minister. I just wanted to ask if the province is prepared in the event of a fifth wave. I know that vaccination rates are quite high, but I just was wondering if there were plans in the event another crop of cases comes up after this one sort of subsides.
I think the Premier spoke really well to this yesterday, and I believe that we kind of are really understanding that our COVID reality is not going to go away anytime soon. And so vaccine and public health measures are going to be needed going into our future in order to keep everyone safe. And so the goal is to get to as much normalcy as we can, but we must always remember right now that COVID, and in particularly the variants that are happening, UK is now looking at a new variant, the situation is now always evolving. And so we need to stay diligent to protect our sensitive healthcare system and to protect the people of our province, and particularly those who are aged and vulnerable. So I think we know that we're in for a new reality, and that vaccinations are not going to be the only way to get out of this. It is the very best protection against serious illness, hospitalization, ICU admission, and death. But I think we know now that indoor public spaces are probably going to remain masked for a while.
Ms. Edwards, do you have a quick follow-up?
Nope, that's everything. Thank you.
Thank you. Vicki Hogarth, CHCO.
Thank you, Bruce. Dr. Dornan, as Bobby Jean mentioned, a large number of the vaccinated people who are hospitalized for COVID contracted it in the hospital. Do we know about what percentage of the hospitalized vaccinated cases did actually contract it while in hospital?
Thank you for an opportunity to correct that. No, the vast majority of people that are in hospitals did not contract COVID in hospitals. In fact, I'll say it's a fairly small number of hospitalized patients acquired their COVID after they came into the hospital or secondary to nosocomial spread. So that is not a common source of infection to catch it in the hospital. In the instance in Moncton, there was a patient that came in, didn't know they had COVID, and were screened negatively, and then became aware that they had COVID when they became symptomatic and with screening thereafter. So no, it's a small percentage of people that are in our hospitals that have it through contact with, or that acquired it as inpatients.
Do you have a follow-up,
I
Ms.
do. I'm just
Lockhart?
wondering, yes, thanks, Bruce. Can you give us an update on the booster shot rollout as far as healthcare workers go? Have most of them already received a third dose?
I can let you know that the booster program has rolled out, and healthcare workers are now able to call and book their appointments as of today.
Okay.
Thank you. Harry Forstall, CBC.
Thank you, Bruce. Minister, what impact will losing those 7,000 employees have on services to New Brunswick taxpayers? Can you be a little more specific?
Well, and again, a little earlier, Dr. Dornan gave a great account of services that could be affected in healthcare, and it will be throughout. It's not just in any one department. It's probably going to affect employees in every department, but also when we look at education, if we have individuals affected in the education system, this will affect every single department, whether it be part 1, 2, 3, and 4. There are employees in every sector that at this time have not shown their vaccination status or have not shown that proof of vaccination. So we are expecting that it's significant. It's hard to pinpoint in any one area which would be more affected than others. We are very focused on our healthcare system and protecting the services that they provide.
Thank you. Mr. Forstall, do you have a quick follow-up for today?
Yeah, can you still hear me?
Yes, of course.
Great, thank you. Minister, what steps have you taken to accommodate those unvaccinated workers to allow them to work from home? How, is there a sense of what percentage of that 7,000 could be accommodated and still not be vaccinated?
As the employer, GNB has made the decision that all employees of GNB need to be vaccinated. And so there has been a very rigorous process in place to accommodate people to have time to get their vaccinations, to have counseling if they needed it. So it is a prerequisite now of being a GNB employee. And so working from home is not an option if you do not work from home. Vaccination is a prerequisite to work for GNB.
Thank you. Merci aux membres de la média. Voilà la fin de notre mise à jour. Merci beaucoup. Thank you to members of the media and everyone for joining us for today's update. Thank you.